The skill that I will be demonstrating is application of sterile gloves. The very first thing that you need to do is to make sure you know what size gloves you will need. And a good way to do this would be to get a box of non-sterile gloves and try them on, small, medium, and large. And this would give you some indication of what size sterile gloves you would need. When using sterile gloves, it would be best to have more than one package available in case when you are applying the sterile gloves that you do contaminate them. That way you will not have to leave to get additional gloves. If you have latex or powder allergies, there are gloves available in most of the facilities that we use. If you need to do a procedure in which you need sterile gloves which are powder-free or latex-free. So you need to seek those out before performing the procedure. The first thing that I would like to do is take a look at my package and make sure that I look at the expiration date on the package to make sure that it has not expired. The other thing is I want to have a flat surface that I could put my package on, and I'm going to be opening it up, the outside cover, and inside will be my sterile gloves within another package. I can remove the package and place it on the table, and I can just discard this right over here. I want to make sure that the cuff end is at the bottom before I open the package, which it is. And now I'm going to proceed and open the package. It indicates my right side and my left side. And what I want to do now, there are directions here. It says to fold down, which I will do. And then I want to take each side and pull it open so that my gloves are clearly exposed. When we begin to put on sterile gloves, it doesn't really matter if you start with your dominant hand or your non-dominant hand. It really is important that you feel comfortable in whichever way you would decide to apply the sterile gloves. In this particular instance, I will be using my dominant hand first. So what I'm going to do is take my non-dominant hand, which is my left hand, and I will have 2 fingers and my thumb, and I will be touching the area of the sterile glove that will be against my skin. So as I pick up my right glove, I will raise it up and I'm going to step back. And I want to step back so that I don't risk contaminating the glove on the edge of the table. And then I'm going to proceed to apply my first sterile glove. Now sometimes the thumb is not in the right area and you do have to move it around a little bit. So as you see, what I'm touching eventually is going to be against my skin. So now my right hand is now sterile. I need to apply my left glove, and a good thing to remember is you want sterile to sterile. So therefore, I want to really take my thumb and kind of get it out of the picture here and put it towards the palm of my hand and just really basically use my fingers to pick up. So sterile to sterile. I can take this to hold this from falling, but as you see, sterile to sterile. And now I will apply, I'm going to step back and apply my left glove. Sometimes you don't always get the fingers in right away, and so you do have to adjust them accordingly and just take your time. So now I have 2 sterile gloves on, so I can touch sterile to sterile. And that really concludes the application of sterile gloves.